Welcome back. We are going to talk about the temporal bone. So I have the skull turned in a more lateral view here so that we can see where the temporal bone is here. This is the external acoustic meatus that we use for landmarks. So this is the right temporal bone we're looking at here. Remember this, we discussed the zygomatic process of the temporal bone that helps to form the zygomatic arch. All right, so um, let's kind of take some things away just to put into perspective where this temporal bone sits. So we have the zygoma bone here, the zygoma. So let's hide that, move that out of the way. Then, we just went over the ethmoid, right? The ethmoid in relation to where that temporal bone sits, right? So let's hide that bone. Working back, here's this greater wing of the sphenoid. Look at the relationship of the greater wing of the sphenoid and the temporal bone. I left this, that's really important actually, to understand that the greater wing of the sphenoid bone, you can see it laterally from the outside of the skull where the zygomatic arch sits. So when you're looking at the skull anatomy, you can see that greater wing from a lateral view, on say like a picture or a drawing when you're learning the anatomy. This is part of the greater wing of the sphenoid, and then this is the temporal bone here. So let's hide that the sphenoid bone. So okay, so now let's look at where those temporal bones sit. I'm going to get rid of this. I like to take things off like little by little so you can kind of see it happening. Here's the frontal bone, right? Let's get rid of this frontal bone, right? But in perspective, right? At the same time, keeping in perspective where the frontal bone sits in relation to this temporal bone. So we're going to hide it, take it away so we can see more of the temporal bone. Now, we can see that the temporal bone reaches very deep into the skull, all the way to the center of the skull. Look at that. That's important to understand, that temporal bone reaches pretty deep into the skull. Right? It's not just the side of our temples where we rub our head when we have a headache, right? It reaches deep into the skull. It reaches diagonally deep into the skull, right? And there's angles that's created there that we'll be talking about. It's very deep into the skull. It holds all of our organs of hearing and balance, all of those little all of the bones in the ear, right? Intra, we have the external acoustic meatus and the internal acoustic meatus, sorry. So, that internal acoustic meatus reaches deep into the skull within the temporal bone. So, the organs of our ears are within this portion of the temporal bone. This portion of the temporal bone, we call it the petrous portion or the petromastoid portion. We'll be talking about the petrous pyramids. They call it the petrous pyramid, this internal part of the temporal bone, where those organs of hearing and balance sit inside the bone. So this is all petrous, the petrous portion of that bone, right? We'll be talking about the petrous ridge, which is the very top of that petrous pyramid, a ridge, like a ridge on a mountain. I call them the mountains of the skull, actually. That's what I call the I'm so sorry, the temporal bones. Let me just isolate this one here. All right, so this is the right temporal bone we're looking at. So from a lateral view, right, just get our bearings. Here's the EAM. We have this little styloid process that sticks out inferiorly. This area right here is the mastoid process, or that mastoid tip that we palpate for the open mouth positioning of a C-spine image, right? So this is it from a lateral view. This is the anterior part. Remember, the zygomatic process projects anteriorly from the temporal bone. So note that zygomatic arch will be just anterior to the EAM. The styloid process is just inferior to the EAM. The mastoid tip or mastoid process is just posterior to the EAM. This area here is called the squamosal portion of the temporal bone. Squamosal means a smooth, rounded surface of bone, the squamosal portion of the temporal bone. So turning it, this is looking at it from an anterior view, right? And then this is from the inside of the skull, like we're sitting in the middle of the skull looking out towards the lateral. So this would be that internal acoustic meatus I was talking about, right? Here's a styloid process here, right? And then this would be that pyramid, the petrous pyramid, this area right in here where all those organs of hearing sit. So this would be that the petrous ridge is this little line, right here. So if I tip this, I can tip it forward. You can see it's the ridge on that, what we call that petrous portion or petrous pyramid, the very top of it. We'll be looking for that petrous ridge in our images of our different skull images to decide positioning, to decide the angulation of the beam. So it's very important to understand this structure. All right, so it's also called the pars petrosa, the pyramid of the temporal bone. Petromastoid portion, petrous pyramid, pars petrosa, and then the petrous ridge, we can identify on our images. All right, so I thought that that was kind of important to kind of take this bone up, piece by piece. So let's see if I can put it back together here, right? So looking at it, tipping the head forward here, seeing where they reach medially, those petrous pyramids, put them in reference to where they sit in reference to the foramen magnum there posteriorly. Turn the head sideways, we can see all this is temporal bone here. All of this is temporal bone. Tip it up a little bit. There's the occipital bone and then the foramen magnum. So you can kind of put it in perspective there too. Tipping it again forward. Zooming in here where it sits here in the skull. All right, this is occipital bone here. All right, so remember where that clivus meets up with the occipital bone towards the foramen magnum. Remember the clivus off of it projects posteriorly from the dorsum sella of the sphenoid bone and then connects here at the occipital bone as well. But this is temporal bone here, reaching medially. So we'll talk about angles of the temporal bone and skull morphology. Depends on the shape and size of a patient's skull. These sit at a different angle. So we'll be talking about that too with those petrous pyramids, petrous ridges of the temporal bone. Thank you for watching.